Today's session is very important to parents and coaches. Why is this important? Because in all these years of my practice, I have seen that when junior athletes get an injury, sometimes it is a little bit late to do anything or to reverse quickly. So there are a lot of things that parents, if they are aware of, and coaches, if they are aware of, they can stop the injury from happening, or if an injury has happened, they can reverse it very quickly. So that's what we are going to talk about. I'm going to give you a general gist about the injuries that kids get. We are going to talk about the growth spurt, ages, and what happens during that time, and what are the injuries that you as parents need to watch out. Because as adults, we are very good about addressing our pain, right? So if we have an issue, we will seek out a medical professional, or we will Google it, we'll look at YouTube, and we'll find solutions. But children, on the other hand, they may or may not know that this is something that they need to address to the parents. Like a lot of parents will tell me, अरे उसने मुझे बताया ही नहीं कि उसको पेन था, 6 महीने तक उसको पेन था और अब बता रहा है. Right? Or there will be one pain which is high, they'll talk about that, but there is another pain which could be linked to that or has caused it, and that they've not spoken about. So as parents and coaches, you will have to be a little bit vigilant to see what changes you see. Okay, the other big thing that I see in kids and parents is the footwear selection for sports, and also whether to understand how to understand whether your child needs a specific kind of shoe for their sport. Why I'll tell you, because some of my kids who are into like competitive sports, when they get into the competitive sports route, at that time they figure out ki, oh, my child is flat-footed, and because of that, A, they are not able to perform as well, B, they are starting to get some pain. Most likely heel pain, knee pain, ये चीजें चालू हो जाती. The parent was vigilant to see कि walking करते वक्त कुछ changes आए हैं, knees हो रहे हैं क्या, या flat foot है, तो वो देख के अगर वो at the age of 8 to 10 years अगर वो correct कर लिया जाता, तो when they are in the competitive route or when they are really full-fledged playing, तभी problem नहीं आती, right? So these are a couple of things that we can address early on for our kids. I'm Dr. Rajani Patil. I'm a spine and sports physiotherapist. I have trained, my initial years, 10 years, were in the US, where I did my DPT, which is Doctorate in Physiotherapy. I picked up my spine and sports certification from there as well. My specialization is in spine and sports. And now I'm in India for the last, 23 years of practice total. And I have been doing a lot of these workshops which are preventive in nature, because all the injuries, everything, all the pain that comes into the clinic today, whether it is for our junior athletes or for adults, it can all be prevented. So at least once a month I do like a free workshop. So be in my community, somehow I'll share the forum links to you. So be in the forum, so whenever there is a workshop that is announced, you can be a part of it. Here at the clinic, we do a lot of preventive programs also. We do fitness for our junior athletes. Our junior athletes generally are with us through the year, because whether or not they are in the competitive route, some of the other pain can happen, and if we can address it quickly, or if we can get them strong, we have a detailed evaluation process where we evaluate the children thoroughly to know what their weaknesses are. तो वो इंजरी आने से पहले एक तो रुक जाएगी, फ्लैट फुट है तो वो करेक्ट हो जाएगा. And we do a lot of work so that we work with the coaches, so that we are together building the child strong, and they can play injury free, right? That's the goal. All right, so that's about me. Sports injuries in children, this is the topic for today. Now you're seeing little kids here, but we are talking about all the way up to our competitive sports, which is our children are, of course, they're not kids anymore, but 18, 16, 18, all these, right? Up to them, from starting from 8 years old is where we handle children. This topic is for them. You know why sports are important for your kids, and that's why your kids play sport, right? What you may not realize is that when your child plays sports, it helps the physical body. So they are getting taller, they are getting their bones are getting thicker, and this will serve them through life. So kids there have been many studies that have shown that children or like adults who are in their 50s and 60s, if they were playing as a kid, not necessarily competitive, if they were active as a child, played football or basketball just for fun, twice a week, thrice a week, these are the kids that developed really strong bones to begin with. And hence, as adults in their older life, they had less trouble. Problems of osteoporosis, pain, joint pain, muscle pain, all this doesn't come, right? So that's one reason for our kids to play sport and for you to encourage that. However, it also depends on what your child is doing, what track your child is doing. So whether your child is in the competitive route, the approach is sometimes very different. And if your child is not in the competitive route, playing for fun, that route is slightly different. And I'll tell you about that in a little bit. So that's the reason to make friends. Of course, other than physical, emotionally, the children are stronger who play sports, especially for team sports. Their social and their EQ is so much better than children who don't play sports at all. So highly, highly recommended. So congratulations for having a child play sports seriously. Okay. All these are the sports that we deal with, and these are the common sports that India में जो खेले जाते हैं मुंबई में. Under the age of 10, generally parents and children don't know whether they want to play frequently enough. They're just dabbling in several sports, and then till they figure out, okay, this is the sport that I want to play, and then they will pursue that, right? So right now we have a sprinter, swimmer, shooter. They are all in the competitive route, but we also have kids who just want to play cricket for fun. They'll do all the local tournaments, and they may not necessarily go to state and national, but they love the sport, so they play every single day. So these are the kids that we need to watch a little bit more carefully and ask them and watch them to see if there are any issues coming up, especially when the growth spurt hits. Okay, now these are the injuries that we typically see. I hope you can see the slides properly. So the first one, ankle sprains, very, 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 very common. Not necessarily in sports like swimming, but any other sport may ankle sprains are very common. Now the problem with ankle sprain is that एक बार अगर ankle sprain हो जाता है of the child, then repeated injury is very common. So अगर एक बार ankle injury हुआ है, please make sure that you are taking the child to a sports physio and getting it checked, because एक बार injury होने के बाद the ligament actually lengthens a little bit, which makes the ankle a little bit unstable anyway. So then if they have not strengthened the ankle with the physio and gone immediately to play again, then repeat ankle sprain. So ankle will twist inside and repeat injury हो जाएगी. First time it may be a sprain, but the fourth or fifth time that your child rolls the ankle in, फिर वो tear हो जाएगा. So we don't want that. Now we want to address that quickly enough. You may also want to figure out कि ankle sprain अगर repeatedly हो रहे हैं तो क्यों हो रहे हैं? Is it because the core is not strong? Is it because the child is flat-footed? Is it because the shoes are incorrect? Is it the turf that they are playing on? What is it? Is the warm-up cool-down not enough, right? So these are things that you should think about as parents and coaches. Let's talk about the knee. Knee में ACL and meniscus. Meniscus is the cartilage that supports, or rather it's a cushion buffer in the knee that protects the joint. But the ACL is the one that gets in trouble mostly for our children. The ACL is the ligament, which is a big ligament. It basically holds the stability of the knee joint, doesn't allow this translation of the knee. But in sports such as football, common sport where ACL injuries happen very, very commonly. It happens in sports where there is cutting. So run karke, if you have to cut suddenly, twisting of the leg happens, and that's how the injury happens. Now, how can you prevent that from happening? By making sure warm up enough ho, core strong ho. This sometimes the coaches do take care of it, but the coaches focus more on the skill development and of course the general fitness. That's where we come in, because we look at individual sports और उस sport के हिसाब से कौन से muscles strong होने चाहिए, that we train. I would recommend, if you are in a competitive sports route, then you should have a coach, you should have a sports physio, you should have a sports nutritionist. Some people even have a sports psychologist. Okay, so these are people that you should have as a sport team. ACL injury generally becomes a little bit serious. If there is a grade 1, grade 2 sprain, that's okay, recovery हो जाती है, but tear हो गया तो फिर then बहुत time निकल जाता है. And then if your child wants to continue to play, तो most of the time ACL does need surgery. So let's make sure we prevent ACL injuries from happening in the children. Wrist trauma, elbow is a big one for obviously tennis. Tennis, badminton mein elbow and wrist get in trouble. So seen it in archery, usme bhi sometimes there is a lot of strain that comes on the elbow, and all this can be rectified if you ask me. When I'm talking about the core, it's your shoulder blades, back, your full back, your abs and your glutes. This midsection of your child must be strong. अगर ये strong है ना, बाकी सब injuries कम आते हैं. So definitely invest in some kind of core training for your child. Okay, shin splints. This is a big one. Calf cramps are okay. Calf cramping होती रहती है बच्चों में. But of course that also should be prevented, because if calf cramps are very repeated and frequent, then it can lead to a calf tear or it can lead to an ankle injury. Foam rolling is something that can help a lot. I have a roller here. If you don't know what a roller is, you should. All your children that play sports, they must be rolling frequently enough. Calf cramps and soreness, this can be taken care of if they have enough electrolytes, their hydration is taken care of. It's very hot, kids are playing outside, no matter, even in the winter, they are going to get dehydrated. My swimmers definitely get dehydrated. Hydration is a big part that you have to take care of. Okay, nutrition is another big one, because this will ensure that they don't get sore and their performance is good. Shin splints is basically pain in the front of the shin, the leg, the lower part of the leg. This one, again, like the ACL, we don't want to take this one lightly. Shin splints agar hai, and if you see your child limping, ask where is the pain. If the pain is in front of the leg on the bony area, then immediately please show an sports ortho or a sports physio. Immediately dikhao, because if shin splints are not taken care of early on, then it leads to stress fractures in the shin, and you don't want that. Definitely your child is going to be out of commission for about 3 months or so. Thigh strain, groin pull, it seems like they are small injuries, but actually I've seen some very bad groin injuries come from in our junior athletes, और वो उसको फिर बहुत time लगता है to reverse them. So all this can be prevented, by the way. All these injuries that I'm talking to you about, all of them can be prevented. Head, neck, clavicle, these are from falling. So obviously if there is a fall, then you have to do whatever you need to do ASAP. Take them to emergency, get an x-ray, speak to your doctor, all that. Hopefully there is some on-field support as well. This is now becoming better in India, where in the tournaments there is usually a physio. So if there is an injury, immediately kuch to hona hi chahiye, because sometimes it's too late na. Otherwise, if you can do something right away, the do's and don'ts you should know as parents. Okay, these are acute injuries. There are 3 types of injuries. One is acute injury, second is overuse, third is growth related. I'll talk to you briefly about all 3 of them. The acute injuries are where gire hain aur lag gaya. Okay, usme you just need to do the needful. There's not a lot that can be done. Broken bones, fractures, things like that. Of course, even after a fracture, the rehab should be done in children, because if they go back to a sport and they're not ready for the sport, then that again leads to repeat injury. It can be sometimes in the same place or in a different place, so you have to be careful with that. Overuse injuries are those जो एक sport में same muscles use होते हैं, right? Like tennis में you will do the same movements again and again. Or football में you are doing similar type of movements again and again. Same thing for cricket. So the muscles that get used the most repeatedly, these are the muscles. If they are not strong, they fatigue, और उसके वजह से the joint that is above or below, whichever is more vulnerable, वहाँ pain चालू हो जाएगा, या muscle में या joint में pain चालू हो जाएगा. So this is the overuse injury, because you are repeatedly using the muscles. Why is it important to address these overuse injuries? You might think, हाँ उसको pain था, पर ठीक है वो वापस जाके खेलेगा, ठीक हो जाएगा. That may be a mistake. If you do it once, that's okay. But if the pain is every single time the child plays or frequently complaining of pain, then you do want to look at it. Why? Because when they get into the growth spurt, their growth may not be as great if they are carrying all these overuse injuries. Because at the end of the day, the muscle is dysfunctional, and the muscle growth is what helps the bone growth. So you don't want to stunt the development of the bones, right? So that's why you want to understand when to give rest, how much time to give rest, when to treat it, how quickly to get them back into sports. So this is critical information that you as parents and coaches should know. But these are some of the common ones. Swimming, may we see swimmers shoulder. For anterior knee pain, this is for across the board all sports में anterior knee pain, front of the knee पे pain आता है जो Shin splints I told you already about. Spondylitis, spondylolisthesis, so this can happen in the back, spine में, for shooters who overextend, archery, where the load on the spine is a lot, and if the spine is not strong, then this kind of thing happens. Stress fractures also, I've seen a few in all these years of practice, and I don't wish it on any child, because the kids get very disappointed when they can't play. And stress fracture sometimes aisa hai na ki it doesn't get diagnosed very quickly, especially in the growth phase. You want to be very vigilant about that. Our kids are very resilient, they're strong, their bones are strong, muscles are strong, but if an injury happens, you need to be mindful to take care of it ASAP. When your child hits puberty, you know puberty age for girls is from 10 to 14. That's the puberty age for girls. For boys, it's 2 years later. So 12 to 16 is for boys. Why I'm telling you the age? Because every child hits puberty in a different way at a different age. But this is the time when they are shooting up. Growth spurt ho raha hai, iska kya matlab hai? This is the bone. Every single bone has this, right? So this is the long bone. This here is the epiphyseal plate. When as children, that is the soft part. वो थोड़ा फ्यूज होने को अभी टाइम है, क्योंकि ये बोन बढ़ रहा है, राइट? सो दिस बोन इज गेटिंग लॉन्गर, एंड दिस द एजेस ऑफ द बोन्स आर सॉफ्ट. Why are they soft? Give them space to grow. But when they are in puberty, that's when it is going to massively start growing. So the epiphyseal plates, they are the ones that accommodating the growth. इस टाइम पे अगर ओवर ट्रेनिंग होती है, क्रॉस ट्रेनिंग नहीं होती है, वार्म अप कूल डाउन नहीं होता है, पेन आया है और रेस्ट नहीं किया है, एट दिस टाइम then this will disrupt this growth pattern. Okay, and there are a lot of epiphyseal injuries that show up, such as what? Stress reaction. Stress reaction is bone में trauma हुआ है, not muscle, not ligament, bone पे थोड़ा trauma हुआ है, and that is just a stress reaction, meaning वो थोड़ा दिखने लग जाता है bone में pain चालू हो जाता है. Growth plate inflammation is what? अगर there is an injury and this epiphyseal plate is trying to accommodate and overtraining हो रही है and care has not been taken, then there will be swelling that builds up in that area, in the both of the corners of the bone, in the growth plate itself. So then it can be a growth plate fracture can happen if you don't follow the do's and don'ts, which I'm going to tell you next. You should have a physio who is willing to work very closely with the coach, because the parent, the coach and the physio have to work hand in hand. And if there is a nutritionist, also that. Now, does everybody need that? No. But if you are serious about your child playing injury free, then yes. These are the two main ones that you want to watch out for. Orthosports disease, this happens in the front of the knee. अब नी के सामने जो बोन है वो नहीं, उसके नीचे थोड़ा सा वहां स्वेलिंग दिखने लग जाएगी. This tibial tubercle, this bone will start to swell. If you see that, please make sure that you are taking your child out and letting the child rest. So these are two areas that you should be watching out for. Orthosports knee के आगे वाला pain and heel pain. Heel pain कहाँ आएगा? यहाँ आएगा. इधर पीछे. It will not be on the bottom, it will be in the back of the heel. So watch out for these two. If it starts and you know it's because of overtraining, then what you can do, you don't necessarily need to take them completely off. Now, you can do cross training. So say, I don't recommend kids to play the same sport 5, 6, 7 times a week. That's not advisable. हमारा main जो passion है वो ज़्यादा खेलो, no problem. But दूसरा भी खेलो, because different muscles use होंगे. So chances of injury are very, very less if you do that. Secondly, playing every single day the same sport अगर है तो rethink that. Is the child doing any recovery work? Stretching है क्या? Yoga तो kids hate. Strength training और कर सकते हो क्या? So can you do other things that will help build the child's overall fitness rather than only playing? Kids who are in the competitive route, अगर आ रहा है state nationals, so then you don't have the luxury to do that. Then you immediately need to see a sports physio. So these are the two that I wanted to highlight for you. Okay, so how will you prevent? I've seen kids who एक दिन football खेलने गए तो protective gear नहीं पहना. That's not okay. Every time, if it is your sport of passion, you have to keep all your gear properly ready. Please remember, when children grow, shoes proper time पे change करो. They need to be changed. Any time that the child has any kind of foot, knee से नीचे pain, see if consultation is needed to check whether your child has flat foot. Playing fields, artificial turf, injuries are chances are higher, but sometimes the infrastructure is not there, so we have to play on artificial turf. That's okay. Just make sure that it is well maintained. You can always talk to your coaches and figure out if that is something that you feel is lacking. Obviously, that goes without saying. The coach is there, sometimes another helper, trainee coach is there. That's great. Supervision is needed. We did a program with Don Bosco where their kids, they are hugely into sports, right? So we had done a walk through just watching kids playing, because from there we were able to pick out कि नहीं इसका form गलत है, something is going on, इसको pain है. These kind of things really help prevent a lot of stuff. And उसमें you'll not believe, there were so many kids who were flat-footed. I was shocked. इतने बच्चे flat-footed है और parents को पता ही नहीं है और खेल रहे हैं और बार-बार injury हो रही है. Obviously the initiative was amazing and it helped all the parents get aware. And obviously then the coaches also started getting aware कि okay, we need to look out for these signs. अगर ऐसा है तो send them. Cannot be missed. I know kids who play tennis, जाएंगे खेलेंगे वापस आएंगे, कुछ नहीं करते आगे पीछे. And again recently I had somebody playing tennis came in with a very bad tennis elbow. But the problem is, are able to miss a few games, it's all right. But kids don't want to miss now. They want to play, but they don't want to do the warm up and cool down. So अगर pain चालू होता है, they'll keep playing through the pain और वो इतना बढ़ जाएगा कि then they have to not play for a long time. That's one critical one. Please ask your children if warm up cool down बराबर से हो रही है कि नहीं. Talk to the coaches. About 8 to 10 minutes minimum warm up. Same thing for cool down. So nutrition, hydration, very critical. Protein intake has to be really good. It has to be great. Remember, when the muscles are growing, the bones are growing. So if the child is playing, there's not enough protein, especially with a vegetarian diet, how is the muscle going to grow? Na? अगर muscle grow नहीं हो रहा है, वो strong नहीं हो रहा है, injury आनी ही है. Definitely a critical part is the protein. Right after they come back from playing, within the 1 hour of every single match, डब्बा भेजो, जो करना है करो, but उसमें डब्बे में होना ही चाहिए some high density protein. Can be paneer, can be chicken, can be egg. Egg is like a perfect food. If you do eat eggs, then you don't need to think any further. But if you're a vegetarian, then you want to do either a cheese का block दे दो, paneer de do, think about, be creative and figure out how your child can get more protein in. And I really appreciate some moms who take, I know a couple of moms of my kids who are in sports right now, on par, perfectly they plan their foods. Okay, that does need to happen because it makes a big difference in their performance. You should help your child understand the difference between soreness and pain. That's a big one. Agar soreness hai, then what do you need to do? प्रोटीन इंटेक बढ़ाओ, वाटर इंटेक बढ़ाओ, फोम रोलिंग करो, ज़्यादा स्ट्रेचिंग करो, कूल डाउन ज़्यादा अच्छे से करो, सोरनेस विल गो. मेक श्योर इलेक्ट्रोलाइट्स आर इनफ इन द बॉडी. क्रैम्प्स अगर आ रहे हैं तो वो वैसे एड्रेस करो, वेदर इट इज सोरनेस और मसल पेन और बोन पेन. राइट, बोन पेन, द इंटेंसिटी फील्स लाइक अ वेरी डल achy pain, right? And it can be a constant pain. A muscle pain is pain in a joint or a muscle. Very different from soreness, very different from growth related injury. So those pains, growth pain injury sometimes can show up as sharp pain. Anytime that there is a sharp pain, that's a big red flag. So ये तो medical professional को दिखाना ही दिखाना. Look at the red flags. I will send you a screenshot of this one because this is important for you to know. If there is any of these signs that you see in your child, immediately take them to a doctor. Don't wait. Think कि आइस कर लेंगे, ये कर लेंगे, फिर बाद में दिखाएंगे. No, these are red flags. It needs to be addressed right away. So if you do see these symptoms, if you have your child is complaining of some symptoms, then what will you do first? Your first line of treatment is very critical. Before you even see a sports physio like us, before you even see a ortho, this is what you should be anyway doing. Never should you be using a hot pack on your child. Never. Ice pack is what you need to do, and I say ice aggressively and obsessively. The minute you come back from playing, if you do the ice pack, the injury will not get worse. So if there is a pain and you're treating it, after every game वहाँ पे ice pack करने का ही, whether or not there is pain that day or not. in the first 24 to 48 hours without fail. And the more of this you do, the faster the recovery will happen. Cross training, very important. If your child is playing only one sport, think about this. What is another sport that your child might enjoy playing? To see what else. I'm not talking about sitting sports. I'm talking about where they're active but using different kind of muscles. If it is football, then it needs to be along with that swimming or tennis. It cannot be football and basketball because they are both jumping. Not to play through pain. See, if it is a low grade pain and it's only every now and then ho raha hai, that's different. Consistently pain aa raha hai on the vast scale 0 to 10 ke scale pe, then you need to do something about this. So cannot keep playing through it. Take the time to heal fully. This also happens to junior athletes. Injury hua, but the parent is very anxious, the coach is very anxious. कभी वापस खेलोगे, कभी वापस खेलोगे, अरे वो डिले हो जाएगा, परफॉर्मेंस ठीक नहीं रहेगी. All this should not happen. Respect the injury. जितनी ज़्यादा severe injury थी, उतना ज़्यादा टाइम लगता है heal होने को. Okay? This patience is important because if you go in too quickly, repeat injury, sure shot होने ही वाला है. Then do physio, conditioning करो, फिर वापस जाओ खेलने. Pay attention to gear often enough for children. For my adult runners, it's okay if they change their shoe every 2 years. Not for children. For they have every 3 months, 6 months. Check karo. Is it feeling tight? Ask. Shoes especially. Time off from sports. Playing through the year, not a good idea. There has to be a time when the child is only doing strength training and fitness and not playing the same sport, because the muscles and joints do need to recover. So 3 months off is a good idea. If you're in the competitive track and cannot take 3 months off fully, then at least short spurts of breaks are needed. I have a kid right now who has an injury for a long time but has to continue to train vigorously because of competitions. So we can't necessarily take the child away all the time from the sport. They have to keep playing. So physio mein we are able to bring the pain down, but the pain will not completely go away till the rest doesn't happen. The parents need to know this, the coaches need to know this. Evaluate for any malalignments. Malalignments are what you want to look at. Again, this is something that shocks me. There are how many kids who are flat-footed और उसकी वजह से knees, knock knees होने लगते हैं या bow legs होने लगते हैं. If you see a child walking anything differently, immediately show your sports ortho, your sports physio, and get it rectified. Right? That's all from my side. I hope this session was useful to you guys. So if you want to watch it again, if you want to share it with other peers, parents, coaches, if you want to share it with your coach, feel free to do that for reference if you need it. So I hope this was useful. Stay in touch. Be a part of my forum so that if I have a next workshop, whenever I have it, I will let you know and you can join. Okay, I'm closing the session. Bye. Thank you for being here.